colorectal cancer is one of the most important cancers we face in this country. It was responsible for about 50,000, actually over 50,000 deaths last year in 2012. And the interesting thing about this cancer is that we can prevent the cancer through screening and other modalities of treatment and prevention. And our interest in this study was to understand the extent to which colonoscopy, which is now the most commonly used screening test, could prevent the risk of diagnosis with advanced colorectal cancers. Now, why we're interested in this topic, specifically advanced colorectal cancers, because these are the cancers that result in death, primarily. Now, a screening test should be able to prevent cancers or detect them at an earlier, more treatable phase. And so we were interested in finding out if colonoscopy does prevent the risk of diagnosis with advanced colorectal cancers in average risk populations. Now, the average risk populations were studied are people who have not had any of the traditional risk factors for colorectal cancer, such as a polyp or a very strong family history of having colorectal cancers. This was a relatively challenging study for us to conduct. For one, we received funding from the government under the ARA mechanism to conduct the study, and those funding streams were only provided for about 2 years. And so the timeline was very short to conduct this very extensive study, but that was not the main challenge. For a study like this, an observational study of colorectal cancer screening, we needed to be sure that we knew the reason why the tests were done. Colonoscopy was used for many years for diagnosis of colorectal cancer, and that is for symptoms or conditions that the doctor felt could be associated with colorectal cancer or other illnesses in the gastrointestinal tract. And the use of screening colonoscopy is a relatively recent use of the test. As a result, we needed to be sure that when we say a test was for screening, that indeed it was for screening. The reason for that is that if we misclassify or put screening tests, diagnostic tests as screening, the chances that the results that were obtained will not be valid. And this has been the issue with some of the tests, some of the studies that have been done in the past. And we wanted to be sure that we address these specific concerns that have been raised in the past about studies like this. So in our study, we went to the medical records, which are imperfect, but does provide information about the intent of the referral. And we provided as much information as we gathered to an expert group who then reviewed the information and determined if a test was for screening. This was really a very important part of the study. And now for a study like this, we had several centers that were involved, and those centers made it possible for us to detect people, identify people who had colorectal cancer through electronic medical records and other sources of data in the healthcare systems. All right, so this, the findings from our study should be important to a wide spectrum of people, from clinicians who provide advice about screening to patients that in the eligible age, to patients who are trying to make decisions about colorectal cancer screening. It is also important for people who are making decisions about providing services for screening, those that lead programs for colorectal cancer screening, policy leaders, and other people who are involved in research in the area of colorectal cancer screening. Because our study does provide answers that to date have not been quite clear. We found in this study that the use of colonoscopy for screening in average risk persons reduced the risk of diagnosis with advanced colorectal cancers by about 70% overall. And on the right side, which is really where the questions have lingered, we found that it seems to be effective by about 60%, which is quite interesting, and we're quite surprised by that level of efficacy, knowing that previous studies have questioned whether or not colonoscopy does work on the right side of the colon. And this is also important because the right side of the colon is where the colonoscopy has an advantage over sigmoidoscopy. Sigmoidoscopy only reaches to the left side of the colon. Colonoscopy can reach to the right. And so that advantage has not been proven to be the case. And this study does suggest that that is the case. This is a very important study. But the more important question that we need to answer is whether or not colonoscopy reduces the risk of dying from colorectal cancer when it's used for screening in the general population. And that's a much more important question for us to answer in the future. There are clinical trials, randomized trials that are going on in this country and in Europe addressing this question. There are also observational studies that have been conducted to answer this question. Now, one of the other questions that we also need to answer is whether colonoscopy is the right test for everyone, and that may not be the case. And so these are also important questions that we need to answer through research studies. And the other important question that we also need to answer is the extent to which colonoscopy is it equivalent or better as a screening test than other screening tests that are used. And these include sigmoidoscopy and the test for blood in the stool that are also available in this country.
Okay. You got it.